COVID-19 is spreading quickly in America's prisons, jails, and ICE detention centers, infecting thousands from Rikers Island in New York to Cook County Jail in Chicago to Turney Prison in Tennessee. And this is just what we can test. The numbers are likely much higher. Crammed into small quarters and provided little in the way of hygienic tools, potentially tens of thousands of America's 2.3 million incarcerated people over the coming weeks will face almost certain death. Activists and incarcerated people are begging for urgency, releasing people from America's overcrowded jails. But widespread apathy from the public and lawmakers has led to little action, even from nominally progressive governors, mayors, and district attorneys. Today, we're going to try to convince you why their plight should matter to you, not just on moral terms, but on practical ones as well, why it's in your own best interest. In other words, we're going to try to explain to you, when it comes to prisons and COVID-19, why you should care. On this episode of Why You Should Care, we are going to lay out to you why you should care jails and prisons in the United States are quickly turning into horrific hot zones for COVID-19. You may have heard someone say, "Who cares about people in jail and COVID-19? They're criminals who deserve to be punished. Let them get the disease and rot." The first and most important reason you should care is that people in prisons and jails are humans, and humans have innate value and rights regardless of their past transgressions. The state, when it takes someone by force and puts them into a cage, has a certain responsibility of care. Obviously, in the United States, they frequently do not meet this standard laid out by the law, but these standards exist for a reason. If they didn't, we would summarily execute everyone for minor parole violations to tax fraud. This duty of care is not being met under COVID-19 pandemic, even more so than usual, and this dereliction of duty is having deadly consequences.
When the state does not provide adequate medical care, they actually are inflicting unnecessary and wanton pain and suffering on the prisoners in violation of the prohibition against cruel and unusual punishment in the Eighth Amendment. Now, to satisfy that constitutional standard, you have to show both that there was inadequate medical services provided or health care provided, and that there was deliberate indifference shown by the warden or the corrections officials, those in charge of maintaining the carceral conditions, the conditions of confinement.
Weeks at sea, the Coral Princess is now docked in Miami.
You've probably heard on the news about cruise ships and COVID-19. Horrific stuff, right?
On board, a third in hospital, as others required stretchers to be carried off, sick with COVID-19. On board, over 1,000 passengers and close to 900 crew members cut off and isolated as the COVID-19 pandemic took over the world.
Okay, now let's take this cruise ship, the now infamous Coral Princess ship that was overrun with COVID outbreak that infected scores of vacationers, and quadruple the population, make the living quarters far more cramped, and have a dozen or more people share a shower and a toilet. Now let's take this cruise ship and put it on land right outside of New York City, and we'll call it Rikers Island. Now take this jail and add 1,719 state prisons, 102 federal prisons, 942 juvenile correction facilities, 3,283 local jails, and 79 Indian county jails, and hundreds more military prisons and immigration detention facilities, all with similar cramped petri dish-like conditions. Now you get a sense of the picture of how urgent this crisis is and why activists are screaming at the top of their lungs to get lawmakers and the public to pay attention. One outbreak in a cruise ship generates thousands of headlines and immediate government action. But much worse conditions, unfolding in hundreds of jails, big and small, state and federal, garner little or no interest. This is all playing out with very little public concern or empathy. You may have also heard someone say, "Still not convinced. It's reckless to let prisoners out to go out in public and infect people." It's actually the opposite. Even granting you don't care about human beings is such, that you're not moved by the ineffable intrinsic value of the human existence, let's look at this from a purely selfish self-preservation perspective. Mass releasing thousands of prisoners during an outbreak makes sense from a public health perspective. Viruses, unlike human beings, cannot be kept inside walls. A sizable percentage of those infected with COVID-19 in jails, prisons, and ICE detention centers are the staff, guards, clerks, custodial staff. These people then leave and go about their day to the grocery store, the post office, interact with loved ones and friends, and those people then interact with people on subways and buses and streets, and those people interact with others, and so on and so on. Indeed, the New York Times discovered that the largest known source of U.S. infections, the hub of a massive outbreak in Chicago, came from Cook County. The New York Times reported, quote, "The Cook County Jail in Chicago has emerged as the largest known source of U.S. virus infections, according to data compiled by the New York Times. At least 353 cases can be linked to the jail. More than have been connected to the USS Theodore Roosevelt, a nursing home in Kirkland, Washington, or a cluster centered in New Rochelle, New York."
Even without this pandemic, prisons and jails faced shortages of medical supplies, medications, doctors, access to basic hygiene supplies like soap. The pandemic has made it clear that jails and prisons are not safe for people living in these facilities or for their guards, vendors, and staff who come in and out on a daily basis. Don't forget, in jails and prisons, hundreds of people share bathrooms, laundry, and eating areas. The toilet tank doubles as a sink for hand washing, toothbrushing, and other hygiene, and people are bunked up in the same cell, sometimes 4 people sharing toilets and sinks in a small space. Meanwhile, hand sanitizer is not allowed in most prisons because of its alcohol content. Air circulation is almost always poor. Windows don't open. Soap may only be available if you can pay for it on the commissary, and many people can't.
Some jurisdictions in New York, Ohio, California, Pennsylvania, Washington state have released a few hundred incarcerated people here and there. And so far, we have seen no reported impact on crime. In general, even before the COVID-19 outbreak, studies show that reducing the jail and prison population has little or no effect on crime, and in many jurisdictions, crime has gone down. In response to their uniquely horrific COVID crisis, the Iranian government has released or furloughed over 40% of their total prison population, or 100,000 people, and thus far there's been no reports of an increase in crime. Colombia and Afghanistan both released 10,000 prisoners. Somaliland, a breakaway region in northwestern Somalia, pardoned 574 prisoners due to the coronavirus outbreak there. You may have also heard someone follow this up by saying, okay, fine, but won't the released people get out and rob and kill and commit crime? Won't it be just like that movie The Purge? Similarly, The Purge has not come to pass in these countries. The Purge also is, of course, fiction. It's a movie. Studies show in times of crisis, humans actually act more cooperatively, and crime goes down, which we've seen thus far during this pandemic. Some activists and lawmakers are making a distinction between those incarcerated for nonviolent and violent crimes, calling for the former to be released. There are downsides to this approach, namely that the distinction between violent and nonviolent crime isn't always clear. For example, mere gun possession in some jurisdictions is considered a violent crime, and people convicted of violent crime are also very much at risk, elderly and those with underlying conditions, and the virus, of course, makes no moral distinctions. Who we release, why, and when can present difficult questions. But these nuances are not a reason to not act and to not act quickly. And it's important we understand and come to terms with the fact that whoever we determine is too risky to be released, we are in effect leaving these people to play a cruel game of biological Russian roulette. At the very least, one must be compelled to hear their voices, to hear those crying out. In videos leaked by activist groups and families, we get a sense of just how desperate the situation is.
They put me in a room that had blood, mucus on the wall. The room wasn't no bigger than a 5.5 by 10, and it's a 2-man cell. The staff there, they all got masks and gloves on, but everybody else don't have nothing on. When you ask for cleaning supplies, they'll tell you okay, but they're going to ignore you. When I asked for the cleaning supplies so I can clean that blood and stuff up on the wall, they said, okay, hold on, but they never gave them to me, never.
Los que estamos sufriendo esta odisea del coronavirus, porque yo mismo soy un padre de familia que tiene 6 hijos, llevo un año sin verlo, no sé, quiero ver si a nosotros nos pueden soltar, no sé, pero que tomen conciencia de nosotros, que somos seres humanos y que no esperen a que el virus entre aquí completo, que nadie se va a acercar con nosotros y nunca nadie nos va a ver, que hagan conciencia y nos suelten.
These people deserve to be released and given isolated housing, even if temporarily. If they don't, we'll have a massive death toll on our hands that will not stop at the gates of prison. Everyone knows this. Lawmakers, public health officials, it's consensus amongst epidemiologists. What's missing is courage. What's missing is political will. And this will won't exist without your support, which is the most urgent and important reason why you should care.
Hear our voice. We are human too.